What's up, everybody? Good morning, good afternoon, or whenever you're watching this online video. So we are going to be talking about, this is the Wellness Points first ever online advanced wellness workshop, I guess. All the other ones we do are live, and this one's online. So we're going to be talking about ear infections. And the reason we're going to talk about ear infections is, number one, many kids suffer from them. Approximately 95% of kids under the age of 3 will have at least one ear infection. And most parents only know that they only think that there are 3 options. Number one, wait and watch your kids suffer. 2, take antibiotics, which don't work. And then later on, you'll wonder why you have recurrent ear infections, which then leads to tubes. So although it's very common that kids nowadays have ear infections, it does not make it normal. Normal is when your body is functioning at 100%. And the world wants to make every disease, childhood and adult, normal and name it. And as far as I'm concerned, you don't have to agree with this statement, but I only like to name things that I want to keep. I want to name my dog. I want to name my cat. I want to name my pets. I want to name my house, my car, my kids. I would like to keep my name because I'd like to keep me around for a little while. But I don't want to name a disease because I don't want to keep it. In the medical system, they want to name and treat diseases. And so I think it's just a different way. This is a different way of looking at it. So the 3 things that most parents think that that's the only option, I want to tell you that there's another option. So ear infections 101. And then if you don't have ear infections, this is how not to get them. So my name is Chad Schleiger. For those who have never met me before, I'm the chiropractor here at the Wellness Point. And I'm going to be your teacher for tonight. And I plan on being your chiropractor for the rest of your life. So whenever you're done using the other chiropractor, or you're only going there based on when the insurance can, not using it to its max potential, you can just give us a call and we'll explain to you what chiropractic is and what it isn't. And you can either call us, you can send us an email if you have any questions about this class or anything else that we do, and you can check us out online at thewellnesspointchiro.com. So before we get started, I'd just like to talk to you guys real quick here, just to get a foundational principle of why we do what we do, and that's the law that our profession was basically built upon. That our body was built with intelligence, that the body doesn't need any help; it just needs no interference. God equipped us with everything. He didn't make us lacking. We're not genetically set up to fail. We're fearfully and wonderfully made. So when we were made and created, a half cell from our mama and a half cell from our dada met inside of a womb, and in 9 months this happened. Every single time. It doesn't matter if you're an agnostic, if you're an atheist, if you're a Christian, if you're Pentecostal, if you're a Trinitarian. It does not matter. Every single time, if mom's interference free, this happens. It doesn't happen by chance. It doesn't happen by accident. It doesn't happen 10% of the time. It happens every single time when that female is interference free. And the eye cells end up in the eye socket, and they don't end up down by the toes, and the heart cells are where the heart needs to be, and they start to pump in the first few weeks of life. And when those lung cells are forming, they know exactly when to take their first breath when they come out of mom's birth canal. All of that intelligence is inside of us. The nervous system is the highway system that intelligence travels to every cell, organ, and tissue gland in the body, and coordinates all those organ systems to work together properly, perfectly, without any interference. So when we were born into this world, for me 34 years ago, for you guys listening 30, 40, 50, 20, however many years ago it was, where did all that intelligence go? Is it still inside of our mom's placenta and we just tossed it out? Or we maybe turned it into caplets and we ate it? Or was it inside of our mom's breast milk, and only the kids that were breastfed got that intelligence and all the other ones don't because they're formula fed? Of course not. The answer is it's always been inside of us. That is the miracle, is just remembering that the answer has always been inside. So the first thing we have to understand is asking the right questions will always lead us to the right answer. So the first two questions that we want to address here is, why do ear infections occur? What's the reason that we have them? Because if the ear infection were truly because of a germ, antibiotics would have wiped these things out years ago. And number two, why does my child get recurrent ear infections? Maybe they've been on rounds of antibiotics, and parents don't understand why their immune system is weakened and why their child has now become susceptible for germs, viruses, and bacteria to set up shop in their system. So if the germ theory were true, we'd all be dead. The fact is that if you add up all the bacteria, viruses, and germs on planet Earth, their biomass outweighs any other form of life on the planet. So if germs are really the problem, and there's no possible way to wipe them all out, maybe bacteria, viruses, and germs are not the issue. The issue really is because our ears do not drain properly, which allows for the fluid in our ear to back up and become stagnant. And when the fluid doesn't move properly, it becomes an opportune spot for bacteria, viruses, and germs to replicate and divide because it loves that environment. Just like if you had two people that lived on the same street and they were neighbors, and one guy did not take care of his backyard. He threw trash out in the back of it, and garbage, trash, food, old food, just threw it out in his backyard. And his neighbor did not, pruned it, kept it clean, mulched around his trees, mowed his grass every week in the summer. Who would have rats and who wouldn't? This guy's on the same street, they're on the same street in the same neighborhood with the same weather. Who would have the rats? It's the one with the garbage in their yard. So the thing that makes garbage in our ears is the fact that the fluid in our ears does not move. So your fluid is going to move through your the inside of your ear through this thing called the eustachian tube. Fluid builds up, it pools, and then it travels down this eustachian tube, out, down into your throat, through your sinuses, into your throat, down into your intestines, and then of course it gets into the acid in your stomach. All the lymphatics that run through your neck travel down through your respiratory system and inside your gut, where then it's removed through the body. So fluid normally goes in that pattern. When that fluid gets blocked, we'll talk about what blocks it here in a little bit, that fluid then starts to build up. When that fluid builds up and it's not draining properly down that eustachian tube, this becomes a perfect spot for bacteria and viruses to set up shop, replicate, and divide. So here's a good picture of what's going on internally in kids' ears that are not moving, or the fluid is not draining properly. So the temporary fix with that would be to pour in a bunch of bleach and kill everything, but that does not remove the cause of the problem. If that fluid is not moving, what's going to happen a week or two later? It's going to start getting green. You're going to start to get algae start to grow. Things are going to start to get in there that shouldn't be in there, all because the water's not moving. So the next question should be, why is the ear not draining properly? Obviously, for every action, there's an equal and opposite reaction. And the fact is that the fluid in the ear is not moving because something happened to the upper cervical spine or the top part of your neck to not allow for that movement to occur. So you talk to a medical pediatrician, almost every single one of them will tell you that the eustachian tube in children's ears are more horizontal, or this way, horizontal, and as they get older, it becomes more vertical, kind of like this, in this direction. Each of those, it almost looks like a V as they get older, those tubes. And as they get older, those tubes, because of gravity, now the tube can drain the water, or drain the fluid in the ears easier, which is why kids, as they get older, they grow out of ear infections. Which is true, but that's only half the truth. And if I only told you half the truth in all of the classes that I taught, that would be no different than telling you a lie. So as they become more horizontal, as they go from more horizontal to more vertical, they don't drain solely off of gravity. They drain because of movement, peristalsis around that muscle or around that tube. There's a muscle that surrounds that tube. So I know that is a throat and an esophagus, and somebody is drinking fluid. But if this person were to do a handstand and drink through a straw, would that fluid go out their nose, go out their eyes, go out their ears? Of course not. There's little tiny muscles around the esophagus, and as fluid gets past the throat, or food gets past the throat, those muscles constrict and move the fluid or the bolus of food down into the stomach. That same exact thing happens with the ears. So when there's fluid in this ear, there's a muscle that surrounds that tube called the tensor veli palatini muscle. That muscle is supplied by the upper cervical spine, the nerves in the upper neck, and when those nerves are irritated or damaged, that hole, that tube is so tiny, it puts that muscle, it causes that muscle to constrict, and it kinks the tube, and it doesn't allow for fluid in the ear right here to drain. So now fluid then starts to build up in the ear, and you get an inner ear infection, right? Which they treat with antibiotics. And if it doesn't work, they do surgery. So the next question should be, why is that tensor veli palatini muscle in spasm? Why is this muscle that surrounds the eustachian tube and is supposed to milk, if you will, peristalsis, milk that fluid out of the ear into the oral cavity, right? Right next to the adenoids. So if those adenoids and the tonsils that are in here, I'm gonna start to connect the dots here of why these things get removed later in just a second. If this muscle's in spasm and it kinks that tube and gunk starts to build up into the ear, why is this thing into spasm? That's the next question that we should ask. Why is the tensor veli palatini muscle in spasm? And here's why. Birth. Happens all the time. Every time we're born into the world, this happens. Some form of it, whether it's a C-section delivery, mom was on Pitocin, had epidurals. Birth is normal, but now we've made it a medical disaster. It's no longer the miracle of life. And it leads to things, birth intervention. So this is where we see those traumas first start in kids, and that the medical doctors, and I understand that these things happen. My wife always gets mad at me, says I'm so hard on, I'm not hard on C-sections. I don't know how else to point this thing out, that it causes damage to people. And if you don't do anything about damage, this is not going to get any better. It always gets worse and leads to worse things later on. So I'm just trying to point it out. So if you've had a C-section delivery, you had a forceps delivery, there was birth trauma, maybe the baby was born too fast and they fell out and they hit the edge of the bed. If you were having a home birth, these things happen at home births. Maybe the labor was like 48 hours and the baby was stuck inside the birth canal for hours, and mom was pushing for hours on end on a cervix that wasn't dilated. Stuff happens, okay? Stuff happens. But that stuff has the name for it. Too much stress on the spine and the nervous system is called a subluxation. That subluxation kinks the drainage system in the neck. The upper cervical spine supplies the nerves that send signal to the tensor veli palatini muscle to tell it what to do. If it's not being told what to do, or those nerves are irritated, that muscle is going to go into spasm. When that muscle goes into spasm, that tube gets kinked, fluid cannot drain from the ear. When fluid cannot drain from the ear, it sits static. This does not happen instantly. It might take months, it might take weeks, it might take a year, but you get enough fluid in that ear and it accumulates, and now bacteria and viruses are starting to accumulate. That sets a risk for an infection. So now you get an ear infection. The kid's uncomfortable, and you're a mom, you're a parent, you're a dad, you want your kid to feel good. So what do we do to make them feel better? Because that's what we think health is, feeling better. Being without symptoms is what most Americans think health is. So now we go take a drug. Now, the most common treatment for that is antibiotics. They take antibiotic treatment, and what happens 5-7 days later? The ear infection goes away. So we go, oh my gosh, the ear infection was caused because of these germs, and the antibiotics cured the ear infection. So does that drain the ears properly? Is the tensor veli palatini muscle still in spasm? Absolutely, it is. So now fluid still sits in the ear. So now 3 weeks pass, 3 months pass. Now you've been on one round of antibiotics at a young age. Does that strengthen or weaken a child's immune system? It always weakens it. So now that sets you up for a recurring ear infection. So because the fluid remains there, your immune system's weakened because you've been on one round of antibiotics. Now you get some growth, and now you get a ear infection. So what do you do when you get an ear infection? It's the second one. It's been 2 years and I got 2 ear infections. So now you go back to that thing that worked the first time. So you get another round of antibiotics, weakens the kid's immune system. A week later, it clears out. Fluid in the ear still persists. 3 months later, you get another ear infection. So now what do? Now that they've been on 3 rounds of antibiotics and it's not working right, and they say, oh my gosh, we can't keep putting you on these antibiotics. They think can create things like superbugs, like C. diff, and things like, if you were a C-section baby and then you were put on antibiotics, now you have a staph strain versus a strep strain. So now we're just going to start to create things like MRSA, methicillin-resistant Staphylococcus aureus, because of C-sections and antibiotics. So now what their next option is, after you've been on those antibiotics 3 or 4 times, is we only have 2 things in our belt. We got drugs and we got surgery. And we tried the drugs, they didn't work, and we don't want to do too many drugs too soon on this young child. So now we're going to drill a hole in their ear. And that obviously does not sound like the best option, but we believe it's the only option. So now they drill a hole in your kid's eardrum and put a tube in it. And does the fluid spew out the child's ear? Of course not. It creates a vacuum and it sucks it downstream. I'm gonna go back here. I don't mean to make you dizzy here, but I gotta hammer something home here. So now you put a tube in that ear and it creates a vacuum. It opens up that hole, and all of this gunk now starts to drip right behind your throat, on top of your tonsils, in your adenoids, and all of this stuff gets infected. So now your kid's got a sore throat all the time after those things. Every time they breathe in school, they get sick. But now because it's a different body part and that part's infected with strep throat and sore throat, what do they give for that? More antibiotics. What does that do to a child's immune system? Strengthen it or weaken it? It always weakens it. So now the kid breathes again. He's got more of this gunk buildup that's just dripping. He's got the postnasal drip that's coming down here. The adenoids are swollen. The tonsils are swollen. So you go back into the doctor after they had the tubes, and the doctor says, oh my gosh, look at those little lymph sacs down there. Of course, we weakened the child's immune system for the last 3 years, and the immune system is trying to compensate and adapt to that because your body's built with intelligence. So those lymph sacs, of course, are going to swell once your immune system was, depleted for the first 2 to 3 years of your life. And they go, oh my gosh, those are the biggest dang tonsils I have ever seen. So obviously God put those things them there by mistake. So we have to cut those things out. So now when you cut those things out, all of that stuff is going to drip down straight into your lungs. And now kids get chronic, problems breathing, bronchitis. They get, things like pneumonia. But don't worry, we got breathing treatments, a nebulizer, inhalers, and you can use that for the rest of your life. Now, obviously, some of you guys have gone down that path, and here in this video, you go, oh my gosh, that's exactly what happened to me. That's exactly what happened to my child. And I can say this stuff with a lot of certainty because this is exactly what happened to me. So if you could avoid that, right? If you could avoid that, would you? Of course you would. That is not what you want for your kids. Not only is it a very expensive route, but it's lots of missed time at school, parents miss time at work, you're missing sleep, your kids, they're not enjoying their first couple years of life, they're on drugs, medication, going to the doctor office, and they're just suffering, right? So this is just a little bit of the research because obviously everybody loves research, and I'm a chiropractor and I have no idea what I'm talking about here. So we've known this stuff for at least 20 years. Norway, by cutting the use of antibiotics in Norway, is the least diseased country. Wow, just by cutting out antibiotics and learning how to live with those nice germs, they somehow become healthier. Back in 1999, primary care-based randomized double-blind trial of amoxicillin versus placebo for acute otitis media ear infection in children under the age of 2 shows no difference than people that just don't do anything with it. They just put water in their ear. There's no difference if you use antibiotics or not. And it won't weaken your immune system by putting just drips of water or breast milk in your ear, right? Anyway, you can read those if you want to read those. Antibiotic abuse has led to increase in ear surgery. Antibiotics ineffective for common childhood illnesses. Ear tubes may not be long-term benefits with kids with ear infections. And you know why they're not, because I just explained the whole pathway of how other things, when you interfere and intervene with the natural process, other things will happen. Antibiotic use before the age of 3 has been linked to 4 times the risk of asthma. Why? I already told you that link. Go back and watch the video if you missed it. 3 times the risk of allergies. Why? Because it affects your immune system and you become Th2 dominant. Later on, you're hyperallergenic because the Th1 system in your immune system was killed because of those antibiotics. If you didn't catch that, go back and watch the video. I explained that link. So according to the recommendations made by the AAP, the American Academy of Pediatrics, this is the advice that the medical system does get, but they still do drugs and surgery. According to the recommendations by the AAP, the only treatment middle ear infection warrants is just don't do anything. That's their recommendation, is just don't do anything. It is more safe just watching and waiting than it is to put kids on antibiotics or opt for surgery. But there is a much better option. We know the thing that increases the drainage system. Restoring normal function. Health is how we function. It is not how we feel. Restoring normal function to the tensor villi palatini muscle. We've seen this in kids where they literally have the oncoming of an ear infection. They come in, they get adjusted. The next day they are perfectly fine. Allowing fluid in the middle ear to drain properly. And then that cascade of events that I just talked about, you avoid all of that. So if you have any questions, if you have a child that has ear infections, adults get these things too. If you have one, you can give our office a call or send us an email. We'd love to help you out. All of our pricing is online. We do not accept insurance. We only accept people. So, and we put you in charge of your health, just the way it's designed to be. So thanks for listening. Stay tuned because there's going to be more videos that you'll like.